speech and language therapist working with adults at Airedale Hospital. I've been working here at Airedale for approximately 3.5 years now. I really enjoy this job because it's in a lovely location. We do work in quite a rural area. We get to see a lot of variety of patients from different backgrounds, and we also get to work with a lot of wider teams. So a lot of my working community is working with multidisciplinary kind of teams like physios, occupational therapists and other teams.
Yeah, same as Laura, I love the location. When we're in the community we're out all day, which is really nice. I've worked here for about 4 years now, and the best part of my job is giving somebody a voice, so somebody who's not been able to communicate, they're able to then communicate with family, with health professionals, with friends, through the aids that we're able to support them with.
The kind of conditions that we work with are people with communication disorders. For example, patients who've had strokes or people that have got progressive conditions like Parkinson's, dementia, motor neuron disease. We also work with swallowing disorders known as dysphagia. That's where we assess people's swallowing and we try to modify diet fluids so people can eat and drink safely. Or we look at long-term feeding options as well for patients.
For communication, we deliver communication therapy, but alongside that, if we've got a patient with a progressive condition, so MS, MND, also stroke, we would support them with communication aid. We have a wide range within our team to support them, and also we work really closely with Barnsley Specialist Hub, who are able to supply more specialist equipment. So we have really good links with them, and we're able to support them with all the communication aids and carry on throughout the communication pathway. Me and Laura work really closely with a lot of MND patients, and I think for me it's they lose their speech. The patients that come to us are starting to lose their speech or have lost their speech, and we're able to provide them with facility to communicate, and it's made a big difference.
So this was provided by our service. It's an iPad with an app called Predictable. Can I show it, Jean? Is that alright? So Jean's able to actually type what she wants to say. A bar here, it's predictable, so it's easier for Jean to use, and you don't get as fatigued because it will predict what you want to say most of the time, and then it'll speak.
When I want to get a point over.
She can also have favourites, so you can set recorded messages that you can just press.
I think a main part of our job is that we actually get to see inpatients and community. So the patients we actually see on the ward, we can actually follow them up in the community. So that patient gets the same therapist or the same team of therapists, so they'll be seen on the ward, and we're able to see them in the community, which not a lot of professionals do that. It tends to be separate community and patient teams, so in that area we're really lucky.
Yeah, it does seem like in this job we are able to give a really good quality of care, and patients do get that continuity of care.
We're very lucky within our team that we actually cover all areas, so both professionals that would specialise in respiratory or elderly, as in our team we cover all the wards in the hospital, and we take anybody in the community with progressive neurological condition or somebody who's had a stroke.
So from working here at Airedale, there's been a lot of development opportunities. As a speech and language therapist, there's a lot of different specialist areas that you can direct in as you get more experienced as a speech therapist. For example, you could work in progressive conditions, you can work in voice disorders, head and neck cancer, specialised dementia cases. There is a big scope for different areas that you can work with as a speech therapist.